is Dr. Tiffany Friesen. We live in University Place. I've got two sons. One is 34 and the other just turned 20. One of my big hobbies is gardening. We have a huge yard at our house and I have things growing on every flat surface. So that's one of my favorite things to do, is get out in the dirt and play around. So I'm a family physician, board certified, and so I take care of everybody from newborns through elderly people. I do lots of procedures. I do lots of joint injections, trigger point injections, mole removals. I just kind of like the procedure end of stuff, so I do a lot of that, and a lot of primary care, a lot of weight loss, a lot of anxiety and depression and medication management. So I'm kind of the jack of all trades. I do a little bit of everything. I wanted to be a doctor even when I was a little kid. I had seizures for a little while when I was in early elementary school, and kind of going through the process of trying to figure out what was happening and doing the workup and then doing the treatment. We actually were able to make the seizures go away completely.
Wow.
And one of my classmates that I went to elementary school with had a similar series of seizures, and her family went down a different pathway to treat her seizures, and I knew her even again in high school, and she continued to have problems kind of throughout her life. And so it was always fascinating to me, like, how your approach could make a big difference in how things worked out for people long term. And so that's part of how I kind of turned my focus to medicine and just kept it there. In Moses Lake, I had two patients that were both about 430 pounds. The one lady was housebound, and so when she wanted to try to come in for medical visits, we'd have to send 2 ambulance crews out to get her from her house. And I was able to get her, even though she was on state medical, I was able to get her approved for a gastric bypass back when that was almost impossible to do. And before we moved out of Moses Lake, I had her down to 187 pounds.
Wow.
Yeah.
That's incredible.
So, yeah, it was life-changing for her to go from being bedbound to being able to get up and go around and do things with her grandkids, and it was just amazing. I think my greatest strength is just my background. My knowledge is very broad. I taught for a residency program. When I worked for the Puyallup tribe, they had a residency, and so teaching residents all the time, teaching medical students all the time. I taught some of the evidence-based medicine courses. I did most of the procedure training courses. So I just have a lot more experience and a lot more exposure to things than a typical physician would have. When you have to prepare talks to teach things to the residents, you have to do a lot of research and a lot of background reading, and so I probably read more journal articles than most any standard out of the office doctor, because you have to stay up on your facts and your new research that's come out. There's a lot of hard parts to medicine. The worst parts are when people are really sick, when they're having severe issues and you're trying your best and there's nothing you can do to fix it. So life-threatening conditions, end-of-life problems, trying to walk people through a new serious diagnosis and trying to find a little bit of light at the end of the tunnel for them. Those are very difficult moments, but that's part of the journey. And so to me, I try to embrace it, and sometimes if we have to cry together, we have to cry together. It's okay. So I feel like if you take the information in as a physician and you just hang on to it and you don't process through it emotionally, then it ends up being a heavy weight on your shoulders. And you can't do that for you or for the patient, because you don't want to get to the point that you're so gassed out that you can't be at full function and be emotionally present in the moment. So I think I do have a little bit different approach than a lot of doctors do, because I don't believe that I'm in charge. I don't have that typical doctor approach where I tell you what to do and you do it, and if you don't do it then I get mad at you. And it's very much more, it's your diabetes, and at the end of the day you're the one who takes it home with you and you're the one who has to deal with it. And so I want to help you find a way to manage it that works with your life. Because if you just hand somebody a pill and say, take this, and they say, yeah, but I get hives, and you say, I don't care, that's the fix, I told you that's the fix, just take it, people don't keep doing it. And over time, if you're not a partner in somebody's healthcare journey, you don't get to stay in the boat with them anymore. They'll throw you out and move on to a different person to help steer. So I try to meet patients where they're at, and I try to give them the tools that they need to find the health that they're looking for. I am actually really thrilled to be here for several reasons. I really like that we're not owned by a large conglomerate. I like that we're not told how to manage our day-to-day patient care. I like that we have the flexibility to kind of let people choose their own pathway. We don't have to follow the exact protocol that's been established by someone else for us. If we want to do it a little bit differently, we have the option to do that. And so that's really nice, not just for the providers, but also for the patients. I don't have the 5-minute visits where you're in and out and you get exactly one question, you get exactly one problem, and I'm going to pick the problem that I like instead of the problem that you're concerned about. A lot of people tell me that they feel like they're running into McDonald's to get their health care. They barely stop at the front desk. They wait 5 minutes for their food. They get 5 minutes with the food, and then it's taken away from you, and they move on to another room. And I don't really like that whole fast food concept of providing medicine. I don't think you do a very good job. I don't think you get to the heart of the matter, and I don't think you can ever deal with big picture issues with a 5-minute visit.